Well, greetings again. This is Dr. Bill Wyatt, and I'm glad to open up here with the American Orthodontic Society, and I appreciate having this medium where we can talk to people all over the world, really, and tell things that we know about. And there's so many things to know about children orthodontics, or if you work with children and you're trying to keep them, prevent them from having really orthodontic problems. Here are some of the things I want you to learn, and I'm going to show about pulpotomies. Let me get started on this as quick as I can. I'm going to go through a lot of slides, but I'll just go through them real quick, and you can go back and take time looking at them if you are really concerned with that. And let's get this going here. This is a young lady here, and you're going to see kids that come in, and you've got room for 3 permanent teeth up here, and there's another one down in here. This is the central, and the lateral, and this one is got in early and shoved this over for some reason or other. The one is down in here. Now you need to know that it is not good to extract these deciduous cuspids right here. If you do that, you give more room than you need, and when the permanent cuspid is developing down in here, it'll move over into that space, and you lose arch length because the bicuspids will follow it, and the molars will follow that, and you will have to do an extraction where you could save the teeth up here if that's what you're concerned about, and then have more room back in the back for your molars to come in. So let's see what we do here in a case like this. So here it is much better to just take this cuspid down. Now, what we do, all you have to do is put a little bit of anesthetic back here and back over on the other side, and then come back in a little later and inject more anesthetic in here, and you will deaden this tooth where they don't feel anything when you go in here and reduce the tooth. So we're going to learn how to do this. This is most valuable in preventive and interceptive things in orthodontics. You can go through so many crowded cases, and you can get the teeth in there, provided the person has no bad habits, like tongue thrust and finger sucking and different things that they do, and mouth breathing and all this. If they're free of those, you can bring in many of these people without doing orthodontics, putting bands on and all that kind of stuff. But this is probably the best type of orthodontics you can do. So now we look on both sides, and you have to, if you take off so much over here, you got to take the same amount over here, and these teeth will shift over. Just the tongue, as they come in, the tongue will push them out in this place, and the lips hold them over here. And I've done thousands of these pulpotomies, and I've never had one of them go bad that I did myself, and I knew how to do it. And so I take this down over here, I'll come over here and do the same thing, even though I don't need it over here. This will crowd up as it comes in here. These teeth will be forced back in that direction. Something happened to them, and they all got forced over here to start with. All right, let's look at what we do now. And you can look at the panoramics, and you can see the permanent cuspids coming in here, and the bicuspids coming in these other spots back here. And now, up above, you're going to have the same problem. You've got to come up and reduce these deciduous cuspids, do the pulpotomies on them. So now, look down on the bottom arch, and you see this lateral coming in right there. Now, how do we you'd think it's just darn near impossible for that to come in right. But we're going over here, do the pulpotomy, and you do the over here, we're going to take this tooth down, but we're going to leave the root of the tooth in there. And we'll just go down and take part of it off. Now you cannot put a rubber dam on the teeth and go down there, you get into the rubber dam, just do it without anything. Now we use a brand new sterile brush, or one that drill that you use. And when I was doing this, we were using diamonds, a long tapered diamond, to do this cut. And you have to see a lot of this permanent teeth will be eating out into the deciduous tooth. So you have to be careful. You don't just go down there and take the tooth off. You go down part of the way and maybe snap that off, and then you can see exactly what you'd have to take off to get that tooth to come in. Okay, let's get going on this. Now, I wrote a paper and published it on this, and it's been years, and we've been doing this, but it hasn't seemed to catch on with people. They're afraid of doing the pulpotomies or something. Here's the long tapered diamond that you can have, or you can go in and get a long tapered carbide burr, and I use a new burr on every patient when I start like that. And we have it, of course, it's as sterile as we can get it. But I do not do, and have not done, a rubber dam on any of these. You get out here cutting into this, you got a rubber dam, just make a big mess out of it. You're not going to run into a problem with it. And so we get it down like this, and I stick something in between here and pop this off, and it'll leave it on, and I can see this permanent tooth over here, and I'll go in and trim it down, and you get down and you're into the pulp now, and we've infiltrated, and this would deaden the pulp on, deaden the nerve and everything on here. They're not feeling anything except the shaking of this. Now I can pop that away. I don't do it there yet, but I took off some tissue there, but it's not necessary. This is a number 12 Bard Parker. Went in there and took a little piece of tissue out of there, but that's not necessary. Now that we pop that away, and now you can see this permanent tooth is inside the root structure of the deciduous cuspid. But if you take this out, then the permanent cuspid coming in underneath here is going to move further in to the front than you want it, and the bicuspids will follow and everything, and you're going to lose arch length. So it's far, far better to do this pulpotomy than it is to just extract those cuspids to bring those teeth in. And that is a fact if you want to know about it. I don't have any double-blind study on this to tell you about it, but I've done enough of them to know what it does. Now, all right, now the way you deal with a pulpotomy is you take zinc oxide and eugenol. Just get some zinc oxide, just a powdered zinc oxide. I like to get the pure kind, and you can get a little pile of it and just lay it out up here. And then we'll put a little eugenol in it and mix it up, and then we squeeze it good and get all the liquid out we can and roll it into a little point like this. Now you take a spoon like that, cut off the tip of that, and it'll stay on the spoon. And now we're going to come back to the pulp. Do not try to get the blood out of the pulp now. And that's where you don't, if you wanted to aspirate, okay, but do not blow air down in there and try to get it out. That's ridiculous. Pack this down into the blood. This is really hard, and it's set as thick as we can get it, and you pack it in there, and then you can take a Malcolm plugger, a little pointed plugger, and push it down. I don't care if it comes out the tip of the root or not, just leave it alone, it's okay. And it'll stay in there that it comes out. And then you smooth this off, then come up here and trim that so it doesn't cut the lip or bother the person right here. And this tooth won't bother you at all anymore. Now we're going to come over on the other side, and we're going to do that to the deciduous tooth on the other side of the mouth. And you look at that, the tongue is going to straighten this thing up here, and you won't have to touch it if the person is swallowing correctly, breathing correctly, and doesn't have any deleterious habits like this. The tongue will come in on this side, it'll push, and these teeth will lean in this direction. That tooth will come in, and let me show you that as we get through. Now pack that hard zinc oxide neutron on there, just leave it alone. And then you don't need any glorious thing in there to kill the bacteria. This zinc oxide neutronol will do it. I've done over 1,000 of these things. Never have had one of them blow up on there. I had an old surgeon who was a DDS and also a MD, and he didn't know how to pack the stuff in there, and they gave trouble, but it worked anyway. All right, now we go on the other side. We're going to take the tooth down the same way, and you see we go right down into the tissue here. If you got a rubber dam, it just doesn't work. You don't need it on there. Now we're going to come in from the top, go down with that, and ream that out, and we've got the same space over here as you have over there, and the tongue will push on those teeth, and the lip will catch them, and that will straighten up, and you can watch it, and it'll do it darn near every time in there, unless they've got some habit where they're doing the tongue different or something, and they're not swallowing, and the tongue guides the teeth. I'll tell you, nobody's teeth come in the mouth correctly, absolutely correct. But many of them, if you have somebody that doesn't have any problem with breathing and no sucking and messing up habits and things like that, the tongue, when you swallow it, pushes in there, and the lips catch it in here, and it lines these teeth up. And it'll do it without any lingual mess you're going to put in there. Just do this to it and watch it. Now we're going to pack that zinc oxide down into that nerve. Don't take the blood out, just pack it right on top of it, and you smooth it off. Then I usually come back and put another little coat of it on there and kind of cover it up and smooth it up and trim that tooth. All right, now we're going to come back in a few days, not a few days, but a few weeks later, and this is what happened. The tongue swallowing pushed on those teeth, and it pushed this over. These teeth have moved over. The midline is getting better, and this tooth will come in and take up every bit of that space, and it'll squeeze in and lay these over to this side. Now you come in, you got to do the same moving thing up above, and we do that. Now I'm going to go through this real quick. This was 1977 when I did this. Look, some people think this is old stuff. Well, it may be old, but it's good, and it will be good 100 years from now to do the same thing, if that's what you're thinking about in here. So we're going to come in and take these deciduous cuspids down up above and watch it go the same way. Now look at this. You remember where this was? This tooth is almost, and it's gotten right inside that cut, and it squeezes in there, and the tongue's pushing on this, the lips catching this and holding it, and that causes a pressure to move in that direction, and this centers out simply by allowing the body to bring the teeth into that place that they want it to be, and nobody's teeth comes in their mouth in exactly the place they ought to be. They get pushed in there in nearly every body. All right, this is a little later. We've done the upper teeth over here the same way. And now look at this. It's gotten better as we go. We don't do anything to it now. Just let it come. And now this lateral will come in here, and this one will come in. You can see it back in there. See it down in there, and it'll come in and straighten up. And you don't do anything. Now there's the bottom when we started, and there it is. It just likes a little bit of pressure here with the tongue. The lips are holding it here. This will gradually move. If it doesn't do enough, you can come back and trim that. It won't hurt. This tooth is dead. It doesn't give you any trouble at all, and it'll come out, and that zinc oxide will come out to him if you pushed it out the tip of the root there. All right, this is later. The upper now has straightened out. This lateral's better. And I'm going to go on to the second phase to this now. Watch, see, this has gotten better, took up this space, and this will come over to some extent where this will move. And you could watch it here and see that will get loose and come out. All right, down the bottom still likes a little bit finishing up. And now these are deciduous teeth, and there'll be a big old cuspid starting in here, or the first bicuspid comes in first. That's all right. Whichever one comes in, you take the other tooth out, and now these two, you're going to have a problem coming in. The second phase of this is we're going to have to go back here and take these teeth down. And we've done, you'll do 8 of these on each patient usually. All right, now the cuspids have come out, and the midline, I guess if you look from this side, it is just almost completely straight right there. Now you come over here, the upper now are just about finished going in. I haven't touched it with any type of orthodontic appliance at all. Just gave nature its how it is the way anybody's teeth come in that way. They get pushed into place. Look how much better this is right now, just a little bit. And this will catch the lip pressure, and this will catch the tongue pressure, and it'll get even better than that. Now we come in for the second phase. The cuspid is way back here. This cuspid is over here. Then you take this baby tooth, it won't have any roots on it to speak of, just flip it out, and we're going to do a reduction up here and a pulpotomy of that. It's going to be different. So we'll get these 2 teeth, and we're going to save enough for the second bicuspid in this area to come in. All right, here we're back on the side now, the lower right side of the mouth. We've extracted this molar, or just it didn't have much root on it. A lot of times you just deaden around there and you just flip it out, you know, it's just a hull. And now we're going to take a burr, and we'll cut down here, and we get in sort of the root down here. We'll take a little bit of the root off. Don't put that gum rubber dam on trying to do this. Do it without anything in there. And you're going to take that off with a clean as burr as possible. Now we come in and we just whack that whole tooth off with that diamond, or you can take a carbide and do the same thing. And now we've reduced that tooth down. We're going to have room enough where you can see in the side. Now take a long tapered, a long burr with about a 4 round burr on it, and we're going to go in the side, and we're going to go down here and then go back and go down in the other deal. In other words, we just make a hole in there and go down and take that nerve out of that tooth, and go down the horns. You got a deciduous tooth like this. The roots are coming out. They're usually tapered out more like this, and you got pulp up in this area. And you come in with this, you cut it off in here, something like that. And you take this round burr and go in and go down this, and go down this, kind of clean it out a little bit, and it's going to bleed. And you come in and pack it, put this zinc oxide used on, just shove it up in there, and pack it in there with an amalgam plugger. Get that stuff so packed you can just mash it, and you can pack it like a amalgam in the tooth. And if it runs out the end, that doesn't bother it at all. It'll come out when the tooth comes out, and it'll stay in there 1 or 2 years if you have to wait that long on it to do it. All right, we've gone in now and hollowed that out. It's filled with blood. It came out like that. Now we're going to take this zinc oxide and just get it as stiff and as hard as you can, and then pack it in there, and it'll get hard, and it'll stay there for years. You don't have to put anything else over the top of it, and you darn sure don't put one of those blooming stainless steel crowns on the thing. Let it go like that. And now we're going to pack that in, and we'll push it in again. I take a amalgam plugger and shove it up in there real hard and smooth it off. And now the little girl looks at you, and you know what she's thinking, but just don't worry about it. She's telling you just about what she thinks of you. Now you're going in and come in, and now look at the midline, right on the money. Look at that tooth. It was down in here. Look at this tooth. It's up in place. Look at the bicuspids. The cuspid teeth have come in now. And here's the other tooth over here. This will go, and they'll do the same thing. And sometimes we come in and do the upper. Sometimes they come out so quick you don't do the other part. But now, I have not touched this with any kind of a pliers at all, and this will do this. But why people have not started doing this to prevent orthodontic problems? It can save people a lot of trouble just by doing this and helping nature out, straighten the teeth up. Now let's go on and do the upper part where we'll come in. We've cut both of these, did this. We're waiting on the first bicuspid to come in, and the first bicuspid will come in and drops right back and takes up this room, takes it up over here, and now we've got plenty of room for the second bicuspid to come in here. The 6-year molars are in that way. Now watch this. You can look in your Panorex x-ray and see this. We've still got a little problem right there. It may never go completely over there. Now sometimes you have to finish up the case with a little bit of orthodontics, but where you put the bracket or something like that on the push and pull it over. Now they'll bring the cuspids in. Now we do the upper pulpotomy. Now you see how the bicuspid came in and took this, got up in there, and the crown just slipped back in there. The root is more narrow, fits in that space, no problem. Now this will do this just darn near every time if you've got a person who doesn't have any deleterious habits or mouth breathing problems like that. Now this is the first bi right here, the cuspid which was down on the inside back here, the lateral, and I have not touched it with any type of appliance at all. And we've got plenty of room for a second bicuspid to come in here. And if you have a little left over, the 6-year molar can move forward into that space. And that helps your class 1 problem too. Now here's the other side. It's the same way. And now the little girl is happier, you know. And so we'll go ahead and if I'm not mistaken, this little girl got married, moved to another town, came back and brought her little girl and wanted me to do this same procedure so she wouldn't have to have braces. And this is the little girl's face. So I thank you for watching this. And don't be afraid to go in there and learn how to do these pulpotomies. Don't make it a big deal. I mean, it's just like putting a filling in the teeth. You know, you go in and deaden it. You can take the nerves out. Don't go down there and think I'm going to get close to the nerve and leave the nerve alone. That'll give you a fit. Take the nerves out of these teeth and pack them with hard, firm zinc oxide and eugenol. And I have not had a single one of these teeth go bad. And I know I've done over 1,000 of these over the years. You do about 8 per patient most of the time. And so I'm going to sign out now. And I don't want to fuss at people out there doing this, but don't be afraid to do the pulpotomies, and do not extract the deciduous cuspids down here. You'll give them too much room. They'll come forward, and you'll have to do some extractions, or you have to back all these teeth back up again. Leave the deciduous root there, and it'll hold the cuspid in place, the permanent cuspid, and it'll come in. So thank you for watching, and I'm going to go and we'll be back again here with a little stuff. So I'm going to shut up and hope you have a good day, and thank you for watching. I feel like I know I've talked to so many people out here over these videos. I feel like I know many of you. Write in and we'll try to answer your questions if I have time. Thank you now. Bye-bye.